Okay, bringing a new baby home is it's incredible, right? But let's be real, it's also a total whirlwind of emotions and physical changes. You are exhausted, you're over the moon, and your body is basically in full on recovery mode. And in the middle of all that chaos, it is so easy to just brush off feelings of anxiety or exhaustion or those crazy mood swings as, just part of the new parent deal. But what if those symptoms are actually pointing to something else, something physical that gets missed all the time? Okay, let's really get into this. So here's our game plan. We're going to break down postpartum thyroiditis, or PPT. We'll start with what it even is, walk through its wild three-phase journey, figure out who's most likely to get it, and then cover the really important stuff, how it's diagnosed, how it's treated, and what life looks like after. All right, first things first. What in the world are we even talking about when we say postpartum thyroiditis? So at its core, it's an autoimmune thing. That means your immune system, which just went through the massive shift of pregnancy, gets a little confused. It basically starts attacking your own thyroid gland. And it's this inflammation that can send your hormones and your whole sense of well-being completely haywire in that first year after birth. And this isn't some super rare condition. The data shows it hits about 5.4% of new moms. To put that into perspective, that's roughly 1 in every 20 women postpartum. So if you've been feeling off, trust me, you are so not alone in this. Let's keep going because this is where it gets a little tricky. One of the toughest parts about PPT is that it's a moving target. It's not just one thing, it's a journey, and it often has these really distinct phases. Now, check this out because this is really fascinating. We often hear about this classical two-part roller coaster where you go from overactive to underactive. But that only happens in about 22% of cases. The most common way it shows up, in almost half the cases, is just the underactive phase. That's hypothyroidism, where your thyroid just isn't making enough hormones. But for those who do go through the phases, here's what it looks like. First up, somewhere between 2 and 6 months postpartum, you might hit the thyrotoxic phase. It's like your body's engine is just redlining. You feel jittery, anxious, your heart might be racing. Then, somewhere between 3 and 12 months, that engine can just run out of gas. This is the hypothyroid phase. We're talking crushing fatigue, brain fog, and even feelings of depression. But the good news is that for most women, things level out and return to normal by that 1-year mark. So that leads to a huge question, right? Is there any way to know if you might get this? Well, let's take a look at the biggest risk factors. Okay, the biggest red flag by a long shot is having certain thyroid antibodies show up in your blood early in pregnancy. These are basically little signals that your immune system is already geared up to attack the thyroid. If you have them, your risk of getting PPT jumps to as high as 50%. That's a coin flip. Other major risks? Having type 1 diabetes, another autoimmune condition like lupus, or a history of chronic viral hepatitis. Getting a diagnosis can be tough because the symptoms of that first overactive phase can look a heck of a lot like another thyroid condition called Graves' disease. And telling them apart is absolutely critical to getting the right help. And this chart really lays out the clues doctors use to play detective. They're looking for very specific things in your blood work. For instance, with PPT, a test that sees how much iodine your thyroid is soaking up will show a really low number. Why? Because the gland is inflamed and leaking hormone, not actively overproducing it. In Graves' disease, it's the total opposite. Getting this right is everything because the treatments could not be more different. Okay, so you've got the right diagnosis. What happens next? Well, treatment is all about managing the symptoms of whatever phase you happen to be in. During that first overactive phase, the whole game is about symptom relief, and this is so important. The powerful anti-thyroid drugs that are used for Graves' disease are not the answer here. They aren't recommended because your body is going to sort this phase out on its own. Instead, doctors might give you beta blockers, which are fantastic at calming down those physical symptoms, like the racing heart or the shakes. After that, it's really just a game of watch and wait. Now, if you slide into that underactive hypothyroid phase and you're really feeling it, that awful fatigue or depression, that's when treatment with a thyroid hormone called levothyroxine usually comes into play. It's especially important if you're breastfeeding or even thinking about having another baby. Then, around that 1-year mark, your doctor will probably start to slowly dial back the medication to see if your thyroid has bounced back all on its own. So, while PPT is temporary for most women, the story doesn't just end after that first year. There's a really important long game to think about. And this is a number you really need to file away for your future health. Up to 50%, that's half, of women who go through PPT will end up with permanent hypothyroidism later in life. That is a 1 in 2 chance. And because that risk is so high, the takeaway is simple, but it is absolutely crucial. If you've had PPT, you need to get your TSH checked every single year. It's a simple blood test, but it's your best early warning system for any long-term problems. And that brings us to maybe the most vital point of all, the one that connects everything together. Those symptoms of an underactive thyroid, the exhaustion, the brain fog, the low mood, they can look exactly like postpartum depression. The experts are really clear on this. Anyone dealing with postpartum depression should also be screened for thyroid problems because it just might be a treatable physical cause for everything they're feeling. So we'll just leave you with this question. It's really a powerful reminder to listen to what your body is telling you, to be your own advocate, and to ask your doctor for that simple blood test if you feel like something just isn't right. It can honestly make all the difference in your postpartum story.